We have to get back to nature. The more healthy and natural products we eat, the healthier we become. Hello, this is Terry Bell with another edition of Herb Doc. Hello, this is Terry Bell with another edition of Herb Doc. I'm here today with Stephen Hanks. And I first met him. He came to our building and was going to show us some massage. And do you want a massage after? No, I'm not interested. Well, he kept on. Because I had a couple of massage therapists. They were good. Some were bad. Some were idiots. Some made you feel bad. Well, just try it. I said, you know what? I'll do a half an hour. And that's enough. Well, I did a half an hour to make him happy because I'm kind of the guy that tries to make you happy. Well, after we went to half an hour, I goes, that's it. You can't do an hour? Yeah, I did an hour. You can't do an hour and a half. I couldn't believe it. So I just wrote some stuff down here. I'm going to read it, and I'll walk through some questions. What a very unique, different type of massage therapist. Really different, which I was amazed at. Okay, he's a therapeutic body worker and a massage therapist located in Winnipeg, Manitoba. Okay, he's been actively involved in natural and alternative health for 20 years. Okay, he's only 21 now. Okay. Stephen survived a medical trauma where he was diagnosed, poisoned, and experienced a near-death experience. It was during this time he started his journey of the study of his mission to heal and repair the body with natural alternative treatments and therapies. Okay, today Stephen is recognized as Canada's master practitioner, a unique specialized therapy that deals with myofascial adhesions, scar tissue, emotional release, and other therapists to be featured in Manitoba's Business Excellence magazine. Oh, I'm glad I'm sitting at the table with you. And I can tell by your talent, you're very good.
Thank you.
But the best I've seen. I see a lot. In addition of caring for his patients, Stephen has been featured on several local and national radios and TV programs. He contributes articles in a variety of health and wellness publications and shares his passion with people for around the world. And I know that. And his career, first of all, starting off here, I got these in order, had them typed out. 20 years, long time to be in industry. Some people 5 years, 2 years.
The industry standard used to be 4 years.
Yeah, and they go broke.
Broke is the one thing, and injured and pain is the other thing.
Yes, and you know what? This is my experience, not on this page or nothing. Reflexologists last an average of 5 years.
Okay.
Therapists, 4 years, if they make it. Because you work hard for your money. I don't know how you can work so hard. You're hard and you do a good job. Then you got the next one to do. So I don't know how you do that. But you have a unique style of treatment. How about give us what is it?
Well, over the last 20 years, I've traveled the world, taken lots of courses, lots of education in Canada, the United States, and I've taken the best of the best and thrown it into the box. So when a patient comes in for the first time, we do an assessment with them, and we're looking at them like a human being, an individual, not just a number. So we've taken all these little tools, and we've come up with a protocol to give them the best type of treatment and result that they're expecting.
Okay, so I noticed that. You had something that nobody else had. I couldn't believe that somebody be working on my feet at the same time you're working on my back.
That was really cool. That came up, a year or two ago. We had a lady in to see us. She was a little uncomfortable. She was having some other issues going on, and Susie walked in the room. And she says, "Susie, don't leave the room." Okay, well, Susie's walking around the table, and she figures, well, might as well rub her feet. She touched her, and the woman came down. And she said, "Susie, don't move." Okay, so she held onto her feet. And as she's holding onto her feet, she said, might as well start working on the feet. And she started hitting some pressure points. So she was at one end, I'm at the other end doing my thing. And we started something called polarity therapy. And we're actually joining each other inside the body, like the yin and yang, the positive, the negative. It was very cool. Now this woman had such an intense experience the very first time with us. She experienced at least 12 emotional releases.
Oh, okay. I know all about that emotional release because you can press on a button and they'll start crying. They didn't even know why that was there, and it comes out and starts to make the body heal up. But you know, it says, you always talk about something that shocks people. They'll ask me after, what is he into these big words? Fascia. What is that?
Well, the fascia is very simple. And the best way I could explain that to people is when you cut a raw piece of chicken breast, you got that thin film on top. That
Yes.
surrounds the muscle. That's called the fascia. When most people come in, their fascia is seized to that muscle. There should be a little lubrication in there. So our goal is to take that and go pull it apart. And when you do that, all of a sudden they can move.
Oh, okay. So that's why you're rolling and
Exactly.
I don't know what it's called there, but it's completely different. Do you have some tools too that you use, which surprised me? You pull those tools first out, you want to get out of there.
Well, these tools that we have here is a very specialized technique. And at one time, there's only 2 people in the province doing this technique. It was me and 2 other doctors. And they actually mentored and trained me. Now, what these tools do, they also release fascia, scar tissue. Very, very intense treatments for plantar fasciitis, tendinitis, IT band problems. The runners get that. We've been having huge success where other people have been searching for years and years. And it was as little as 1 to 2 treatments, you can get them back on their feet and going.
Oh, good. So what would this one be?
Well, they're each different. They got different little curves on them. One will get into here, one might get into there, into hairdressers. They're working like this all the time.
Yeah.
Their hands tend to curve in. It's good to get right into there to release that scar tissue and fascia deep down below.
And how long usually is a session, you know?
Oh, you know, we don't go by the egg timer. Most people in the industry have a clock that ticks and it goes, oh, time's up. We try to leave at least 90 minutes between treatments.
Okay.
We don't want to rush the people.
Really good. I noticed that. You were trying to keep me in. I was trying to get out. After a while, I was trying to stay in. You were trying to get me out. This is Stephen Hanks. We'll be right back after this message. Hello, my name is Terry Bell, and I'm going to tell you about a nice, wonderful product that I found. This product I took and I give it out to people just to get rid of it. And they would come back in a few months and said, I can't believe how good I digest food now. A lot of people with heartburn, you can get puffed, bloated, gastric, burping, farting, may lead to constipation or diarrhea. If you have a digestive problem, and what is in this little product, you're hearing about probiotics all the time, and they cost hundreds of dollars, 60, 70 bucks a month. Over the year, it's going to cost hundreds. This one is very cheap. For a month, about $17. Don't have to refrigerate it. You just keep it in the bottle with a meal twice a day. You have heartburn that never quits, you need this product. In fact, we were brought up Mennonite, and if you ever let gas go in church, we had to sit in our own pew. So you know what I'm talking about. Gas is horrible. I even had a customer that came in that every time she walked, she would let gas go. After being on that product for a little while, she said, I can't believe the first month I seemed to get more, and then it disappeared. And what it does, it makes you digest all your products. There's a prebiotic in there, a probiotic, acidophilus, bifidophilus, and friendly bacteria. They're all in one. You don't have to spend a fortune to get well, just 2 capsules a day. See your Sho-Tai practitioner in your area. Look them up, Sho-Tai practitioner, or Google Terry Bell, and they'll tell you who's near you. You can pick those up. Thank you very much, and I hope you have a good meal tonight. Hello, Terry Bell, a Sho-Tai practitioner. I'd like to tell you about an amazing product called Bentonite. Bentonite, it's a form of mud. And how they discovered it, they were poisoning the rats, and they thought these rats were incredible. They'd poison them. They'd go down the ground and come back out. They found out how could they still be living? So they shot a few of them, opened them up, and they found out they'd go down the ground and eat bentonite. Bentonite is charged negative like oxygen, draws poison into it, and they poop it out. So if somebody has an irritable bowel, amazing product for getting rid of irritable bowel, Crohn's or colitis. Somebody has diarrhea. Okay, remember I said you don't want to fart around with that. Diarrhea, that's a horrible problem to have. You have aches and cramps and pains. Bentonite, 2 twice a day. You'll be amazed. Somebody has dry, itchy skin, psoriasis or eczema. I've had many testimonies that they had horrible psoriasis for years, and you'll see some of them posted now on our website. Psoriasis and eczema is gone. Okay, just from bentonite. Food radiation poisoning, and a big one, acne. Acne is a big one. You know, you don't want to put the squeeze on anybody, but if you see a big, ugly pimple, you want to just take the person and squeeze it, give them bentonite. Another thing they could use for acne, beta-carotene. Beta-carotene and bentonite to clean that up. What a good product. Tonight, you want to have bentonite, okay? Maybe he's not your type of guy, but you'll like him. See you again. I just had to say bentonite. Hello, this is Terry Bell back again. I'm with Steve Hanks today. He's from Winnipeg. If you just tuned in, very amazing massage therapist. It's different than anything I've ever seen. Now, what are the 3 main things a patient feels after they've had that done to them?
Well, usually the first thing they say after they've seen us is, I've never experienced anything like that before. And at first I didn't know how to take that because, wow, how bad was it? But then we got that moment. And a lot of people end up in a little bit of the fog, like yourself. When we worked on Terry the very first time, we went out for lunch right after, and Terry couldn't converse at all. Terry was very quiet for that hour. Yeah. The next thing people experience is usually a lot less pain. They have a lot more mobility. But the biggest thing is at nighttime, they sleep soundly throughout. And that's, as you know, we need sleep to heal. And that's huge. They wake up in the morning, they're refreshed for the first time. And sometimes they don't even realize that they have no pain. Extreme cases. A lot of other times, people just seem to have a zest for life. Things change, and they don't even realize that emotional release may have took place.
No, and that's exactly what it was, an emotional release. I noticed the part about sleeping. Mm-hmm. You sleep good. And the body rejuvenates from 11 o'clock at night till 3 in the morning. And that's the time you want to be sleeping, because if you're not, you're tossing and turning. It's not. So what do you suggest to a patient do right after? Because some people stagger around. Next person wants to jog. Next person wants to just go eat, like you said.
Yeah.
What do you suggest they do?
Well, the first thing I suggest they do is to keep moving for a little bit. We want to reset the left brain and the right brain because they're in a little bit of a fog. The next thing I'm going to encourage them to do is sip some good, highly alkalized, mineralized water. Why we want to do that is because of the oxygen potential of that water. Massage is like a workout. A lot of people get lactic acid buildup. We want to flush that out so they're not sore the next day. A lot of people have gone for massage and they are very, very, very sore the next day. Most people that see us, they don't have any pain the next day because they're sipping the alkaline water right after. So I want to encourage them to walk around, move around, go shopping, sip their water, then have a nice shower. Because a lot of people, after they experience our type of therapy, they're going through a little detox. And they're going to notice they start to smell. If you get a guy coming in that works in the factory, he's going to stink like the factory. Railway guys come in, it smells like diesel in the clinic. Other people come in, chain smokers, people on medications. You get a person on 28 different medications, it smells like rot coming out of there. So we want them to have a nice little shower, purge the system, and get some good sleep.
How many people do you usually do a day?
I used to see an average of 7 people a day, and that was too much. So we've cut it down, we cut back our hours. I like to say we're like part-time, full-time.
Yeah.
We don't want to burn out. We're going to educate in between, but we're also going to heal ourselves. You just can't keep on burning the candle for 7 days in a row like I used to.
Yeah.
At one point, I was the busiest therapist in the city. That was insane.
Yes.
So we got to work a little smarter.
I'm like that with the herbalist. I believe I'm the most busiest herbalist across Canada. And you really work heavy. You know, you got to work, you got to put it. And if you don't put everything into it, I can tell right away, you're not doing your job. What is therapeutic massage? Like, what's the difference? Isn't they all the same?
Well, a lot of people Years ago, 20 years ago, the average person coming in for massage was woman, 40 years and older, and they were just getting a massage. In the United States, they like to call it a petting session. Okay. Here, we like to call it fluff and buff. It was just a massage. Some people were a little bit more aggressive. They were doing different styles, but the average person coming out of school was still just doing the fluff and buff. People nowadays, they don't want that. We got kids as young as 7 coming in. The ratio to men and to women is about 60-40 now, but they have serious injuries and problems, and they're coming in for help.
More women than men?
Days. Yes, more women than men. It used to be 90% women, now it's about 60%.
Oh, okay. So how young, like you said, you took them 7 years old?
7 years old has been the youngest. My little boy, touch is, as long as it's healthy, is very therapeutic. People are starting to notice more things because we become more educated thanks to the internet. So they're looking for alternatives.
So there's even people I call in and tell them, you know what, there's a guy in here today doing massage. Go see him, I'll pay for it. They're surprised that I'll pay for them, but I want them to try it once, because once they had it, they won't go to another massage therapist. We'll be back right after this message. Thank you. Hello, this is Terry from Herbal. I'd like to tell you, some days you don't even feel like yourself. You notice part of me seems like I'm not here. People make jokes like, quit while you're ahead. That's all you see here. And the person doesn't feel good, he feels empty inside. And I can tell you what it is. It's called essential minerals. There's a little bottle here, it's essential minerals. It's 10 times stronger than normal, so you only need 5-10 drops a day. Sometimes that'll last you a year, that bottle. Sometimes it'll last you 6 months, depends how hard you work on yourself. I found out about a thymus problem. And what is a thymus problem? When kids are born, their thymus is over 90. And you could stick a kid in an environment for 2 weeks, stick him into that environment, and he can learn a language in less than 2 weeks because he has to learn that. Some people said it took a month. So what if we could do that? That's because the thymus is open and it's full. Thymus starts to shrink, and you test your thymus. When I test mine, it's 5, 10, 15, 20, 19, 18. It's at 18%. That's quite high. That's smarter than the average person. It's usually at 9. They have a hard time to learn. I start taking this product, and it come up from 9 to 18. I noticed as I'm driving along, I'm remembering phone numbers from all over the place. Phone numbers, old addresses, names, and everything else, just from getting your thymus up. Start taking that mineral, and you feel better and better and better. You only need a dropper full a day. You'll feel better and better. Then instantly, you will start feeling you're back to normal again. Oh, there, that feels better. I feel like I'm myself again. That part of me is missing. When you don't feel like yourself, you're missing minerals. Grab some essential minerals. Hello, this is Terry Bell. Has this ever happened to you? Tired of farting around? Here's a product I'm going to tell you about today, and it will start working on your bowel. If you get puffed, bloated, gastric, burping, farting, it could lead to constipation or diarrhea. You have a bowel problem, and you need to get the products for it. Any one of those, this is the product you want to be looking at. If you know what I mean, if you have a bowel disorder, irritable bowel, nothing's going to fix it medically, because the medicine, you know as well, fixes one thing, downs 10 others. 2 things make you sick: an excess of one or a deficiency of another. An excess could be like a cow eating meat, eating the wrong foods. The other one is a deficiency of another. This will compensate for your deficiency. Like I said, are you tired of this happening and farting around? Well, don't do it anymore. Get to the problem and let's get it over. Okay? Thank you. I will see you in my office again. Thank you and bye. This is Terry Bell back again with Herb Doc, and I'm here with Steve, a massage therapist, if you just tuned in. You know, what about the government? What about them? You know, there's people on compensation and everything. Are you covered under that? Because a lot of people are, next people aren't.
Well, right now in Manitoba, massage therapy is not legislated, and that's something that we've been fighting for a long, long time. The problem is, if we become legislated, that means it's open for everyone. So Autopac's going to be forced to cover it, workers' compensation is going to be forced to cover it, and there's too much money at stake here. They don't want us to be legislated.
Do you think it's going to go through?
Eventually, I think they'll just have no choice to do it. But right now, if you have a claim with Autopac, you have a claim with compensation, if you talk to your adjuster, there's a lot of adjusters that will pass it along and they'll allow it.
Okay, so let's say you got in a car accident. How many times a week would they be allowed to come?
Well, that's individual case by case.
Okay.
Right now, massage is covered if it's performed by a chiropractor. Makes no sense, but that's the rules.
Okay. Oh, okay. That is really different.
Yeah.
Then tell me, do you have any miracles? People doing massage?
Just like you know, throughout the 20 years, we got tons of people, tons of testimonials. We have a lady with MS that came in. It was an emergency crisis situation. She was driving into town. She's got pain. She can't move. She can't dress herself. She can't put on her shoes. Her kids are helping her out. Can she come in and see me? So we got her into the clinic. I played it out in my mind the night before what I was going to do with her. And we did some very specialized work, but the whole big thing was to get the nerves to fire. We talked about the water, we talked about other things, but the big thing was to open up the sacrum here, put some kinesio tape on top and just get it to fire. Bang, bang, bang. When we were finished with her, she was able to get off the table on her own, get dressed, put on her shoes and walk out the door. That was really cool. Another big one was a woman came in off the street with back pain and she asked if I can go deep into the psoas muscle to release that back pain in that muscle. Well, I don't like doing that to first timers. It's not the most comfortable thing to do with somebody, so I said, okay. So this lady told me she was a nurse, but she was on disability. They didn't know what was wrong with her. They said she's got chronic pain, chronic fatigue. She's got some depression now, anxiety. She can't sleep. They said, you got lupus, you got MS. So she was on drugs for everything, on disability. So as I was releasing the muscle through her stomach, the psoas muscle, layer by layer, as I'm going deeper and deeper and deeper, it's like a balloon letting go. And through this release, she starts moaning and groaning, and then there was silence, and then there was tears. And I said to her, what's going on? You know, I've been doing this for a long time. And she told me she realized for the first time she was sexually abused by her uncle when she was 14. So we had a little discussion. She went to the Laurel Center here in the city for help. And to this day, she came in, she gave us a big hug. She said, you know, she's off all medications now. But she said, why did they do this to me? You see, because of all those medications she's on, her heart is shutting down, her liver is shutting down, her kidneys shutting down, and she's dying. That's so sad.
And is she now dying, you mean?
Yes, because of all those medications.
Yeah, well, the side effects are worse than that.
They didn't know what was wrong with her, so they just said, okay, maybe it's this, take that.
Yes.
But it was the one treatment. She just came in off the street and asked to release that muscle for the back pain because some other guy used to do it for her. And it changed her life.
Right here, you know, you told me at one time you're in 17 car accidents. Like, wouldn't you learn after the third one?
Well, I learned not to drink and drive because you might spill a drop.
Okay, yeah. And did you? Was it drinking driving?
Yeah. I used to drink lots when I was young. I was drinking about 2 6s of hard liquor and a case of beer a day. 17 car accidents, 6 head-on collisions. And the interesting part of the story is I never got hurt. I never had a broken bone, never had a sprain, a bruise, a cut, anything. And I was in Huntsville, Alabama, sharing this story with a group of people. And somebody, you know, I never went to church, I never had God. And somebody arose from the audience and said, yeah, God was there for you. He was watching over you. You got a purpose here. There's a reason you're here still after all this trauma you've been through. You know, I was poisoned by a doctor at Concordia Hospital. I did the near-death experience like we were talking about earlier. I was out for 2 years recuperating, just sitting, rotting away in a chair. And that's when I got into all this natural health. I started reading everything I could about how do I heal and repair the body and get the poison out. And that's how that whole journey started.
Okay, but you said you never had any broken bones? Nothing?
Nothing.
So you've never had broken bones?
Never.
Oh, okay. So who massages you then?
Looks like Susie.
Okay. Because usually somebody asks me, who tests you? I test myself.
Okay.
I just walk through the system and test and see what's wrong. And I always look in the mirror and say, you know what, do you know a good tester? Yeah, there you are, and I do it. But
I guess you can look in the mirror.
And you can go back and forth and test.
Exactly.
And if you're very confident, you know what, one thing about muscle testing, they tell you if you think, you can change the answer. That's why I tell everybody in our Sho-Tai, do not think. You can say, oh, his bowel is at 30, it's got to be at 30, and you keep thinking it and test. You always say, I'm testing, because I don't know the answer. I see you've now come to our class. What could you pick up out of our class?
Oh, what didn't we pick up? After 20 years in the business and traveling around the world taking courses, your course has been the most exciting and most knowledgeable. And not only that, there was so much humor injected into it. So you weren't looking at the clock, you weren't falling sleeping in the chair, you were just sucking it all in like a sponge and saying, I want more. So we're here again for the weekend. We want more, so now we can pass it along to our patients. And we are now sending our patients here to get tested as well, to take them to the next level.
Oh yeah, and you know what, most seminars I go to, everybody's looking at the clock trying to get out to go to the pub.
There you go.
This one, we come back in the evening and everybody stayed till 10, and they asked, Art told him he had to get out because he had to go home that night and see his wife. Because it's time to go home. Amazing, I'm glad you enjoyed it. This is Terry Bell with Steve, and a massage therapist. If you ever get a chance to go see him in Winnipeg, and what is your phone number there?
Area code 204-770-4414.
And you call them, you'll have a real treat if you see them when they do a massage on you. You won't forget it. I'll never forget it, and I've tried. Thank you very much, Terry Bell, saying good night from Herb Dog. See you next week.
Thank you, Terry.